Hello, YouTubers. I'm still using my iPad and trying to get a good position, so bear with me. I just wanted to give you an update. I'm back home, as you can see, from a lounge room. No hospital stuff behind me. I feel good. I got home yesterday morning and just sort of unpacked, had a nap, went through all my medical supplies that was given to me by the hospital, pack those away. I'll do a video on that later. It kind of stole the idea from another YouTuber. I can't remember her name. I'm getting used to everyone and I'm terrible with names, but she's a little cutie face in America, in the South. She's got the southern accent. She always had a really good idea about buying one of those hang on the back of the door shoe bag things with the pockets. And all my stuff just goes in there. There's heaps that I've got from the hospital and it's all fit in nicely. So I've got all my bags, my plates. I've got one piece, I've got two piece, I've got adhesive remover sprays and wipes. I've got gloves. I've got a belt for my ostomy bag, which is really good. It makes me feel a bit more secure. I'm still up in the air whether I'm preferring the one piece or the two piece. They've both got their pros and cons. I like the two piece because I can see where I'm positioning the base plate or wafer, whatever you call it, wherever you are. And then I can just put the bag over that and it makes it easier to see. What I don't necessarily like at the moment is that I am feeling a bit of an itch under the tape, but I think that's just because my hair's regrowing, so I'm not too concerned. It doesn't feel rashy or anything. I think it just feels like itchy hair regrowth, which we all know what that feels like. What else? Yeah, the one piece is nice and easy. I've been showering with my bag on. I was changing it every day in hospital just for the training purpose, but now I'm to two days and I can change it. I really like rinsing it out with a bit of water when I do empty it as well, so that's just makes me feel a bit cleaner. I am feeling really good. I'm sore, obviously, from the surgery itself, but the improvement, like I didn't realise how sick I was or how much it was damaging me. I mean, I did realise, but not to the extent now that I can actually compare how I'm feeling now to how I was feeling last week before the surgery. Everything down there just feels obviously sore from the surgery, but I can tell the difference. But in the lower digestive system sort of area, sort of behind the pelvic bone, that was just always excruciating, and I was living with that every day, and it was just awful. And I'm going to tip this down a bit. There we go, a little bit better. I'm just in my recliner, so sort of all puffied up here, but because I'm sort of reclining a little bit. But yeah, look, as I said in a Facebook post I did, I certainly don't recommend that everybody go out and get the surgery or anything like that. It's not a recommendation. All I can say is that the people that were in my boat, in the same boat as me, I should say, that were finding that, I mean, I went nearly a year without any medications working at all. And I was just getting sicker and sicker, and there was more pain and more pain. I would get to the point where I'd have 3 bites of food and I just felt like I'd eaten a whole banquet. It was just like everything was just all condensed up here because further down everything was so inflamed, nothing was getting there, so everything was sitting up here. That's how it felt physically. And now, after getting out of hospital after the surgery, of course there's still inflammation there, but it just feels so much better. There is inflammation there, but I feel less inflamed, if that makes sense, because nothing is passing through my colon, which, as you know from the last update, the doctor did a colonoscopy at the same time as the ileostomy, and colon's a bit screwed. It's gone all stiff and brittle. Hose pipe colon is what he called it. So it's basically not flexible, and obviously we need a flexible colon because the gentle muscle spasms helps your stools move through down into your rectum for then passing out normally. Mine weren't really doing that because it was brittle and stiff. I can't remember the exact words he used, but So basically what was happening to me is that I could only pass stool when there was enough backup to push it through. My muscles weren't working to push that through. So that explained a lot of the pain that I was in as well. So comparing that pain to how I'm feeling today, I don't have any of that because everything got cleaned out before the surgery, and then nothing's passing through my colon now. It's all coming out through my small intestine, out the ileus, which is the end, the connector point between the small and the large intestines being separated, and brought out through my right hand side on my abdomen. So I'm just emptying straight out into a bag. So I'm not having any of that backup. That it's like constipation times a million. It's stupid flies. It's summer here in Australia. So yeah, I just feel really good. So I kind of went off topic, but those people that have not had any success with medications, I've got to the point where I've had all my oral medications, nothing's worked. I did a lot of research about this. I watched YouTube, and this is why I'm doing that, because a lot of people's personal experiences has helped me get some real life stories, not just the medical facts saying, oh, this is good, get this done. Those medical type videos that just show you the clinical, what we do, and this is how you'll feel. I wanted people to say, hey, I'm really upset, I had a leak last night, or I had a blowout in my bed. So I knew the bad with the good. And weighing up the bad with the good, the bad is just nothing compared to the way I was feeling. So for me, this was the best decision to make. Obviously, with the doctor telling me about my colon and how it is at the moment, obviously I'm looking back, definitely made the right decision, and I probably made it at the right time. Leaving it any further, there could have been ruptures, there could have been anything. So I was a bit lucky. So those who are thinking, I'm at the end of my rope, my drugs aren't working, I feel shit all the time, I can't work, I'm going to lose my job, I'm so depressed. All of us felt this at one time or another, and they're not good feelings because you're dealing with this horrible disease, you're going through the pain, physical pain, and exhaustion and all the other things that go with it. And then on top of it, you have this mental anxiety and depression that can seep its way in because you're feeling like you're sinking down this dark, dark hole, and you're sinking further and further, and there's no way out. All I can recommend is, even though you don't want to make the decision, do the research. Don't go in blind because, there are things that aren't great with this surgery, like, you're pooping in a bag, for Christ's sake. It's stuck on your belly, on your abdomen. It's something that you're going to have to empty all the time. It's something you have to change all the time. You'll clean it out all the time. You worry about smells and how you're going to dress afterwards. And I'll probably do some update videos as well on that, even though there are a lot of people out there that have already done them. There's not too many men ones out. I'm finding that I'm having some trouble with my waist pants. I'm wearing really loose sports shorts like you wear to the gym kind of thing. However, they do create a little bit of a close on the bag, that the pants sort of press on the bag. So I'm finding my output's kind of sitting at the top a little bit, and I have to sort of pull my pants out a bit, push it down, and then I'm fine. But I really want to find something else for that. So I'll speak to my stoma nurse. She did mention there are wraps. There are underwear that you can get that are a bit high-waisted and they've got pockets inside. So I'm going to have to talk about some solutions with her about that. But I just wanted to let you guys know I am doing really, really well. Some funny news. My sister, my baby sister, who's in her mid-30s, but still was my baby sister, even though she's got 4 babies of her own, she's just completed her nursing degree, double degree with midwifery. But they need to do their nursing first. So, funnily enough, she's got a placement at the hospital that's only just down the road from me, 10-15 minutes, and she's going to be working on the colorectal ward as one of the nurses on there. So, I don't know how long that will go for. It's not a big deal, but it was just a bit of a coincidence, and I was having a joke with her that if I get a blockage, she'll be my little nurse me back to health. Personally, I don't want her doing any of the yucky stuff. She can just come chat with me, sit with me. I know she's working, but whatever. I'm her brother. Bring me a cup of tea. Just having family around. And one thing that I've learnt after this surgery is knowing how sick I was is family's everything. Obviously, if you've got family who are quite toxic, obviously not them, but the family that you're close to, get closer, see them all the time. Anything can happen. If I left it any longer, I could have died. Not a very high risk of that, but I mean, if I had a rupture in my colon and I had fecal matter leaking into my abdominal cavity, that's toxic situation here, and that could lead to death. So I'm extremely happy that I did what I did when I did it. Try saying that 10 times fast. And I feel really good. I'm 46. I know I'm sort of at the mid stages of my life, and if I have this bag for the rest of my life, what is that, 40 years, 30 years, 50 years, whatever, it's still a bloody long time. If you're in your early 20s, I understand that thinking this is the rest of your life is so worrying and stressful, but you know what? It's like anything else. I'm diabetic. I manage my diabetes. I take tablets every day. I prick my finger to get the blood sugar readings. It's something I manage. I have hay fever. Not a big deal. I take a hay fever tablet. Hay fever tablet once a day. It's just something I manage. Non-medical. You go to work. There's a train delay or a train cancellation. It's annoying, but you manage. You'd be surprised how resilient we all are when we come to the push, and how we can just adapt. We're naturally adaptable animals, and we will adapt. Now, I'm getting to 12 minutes, so I'm going to wrap it up here, but I don't have many subscribers yet, and I'm hoping that will change, because I really want to be a voice of information, not of medical diagnosis or medical instruction. I just want to give you my information about me. Some people might go, oh my God, you're exactly like me. You've had the exact same symptoms. You're exactly the same type of person. You're a man. You're a male, gay, living in Australia, blah, 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 blah. Or you just might be completely opposite to me. You might be female. You might be whatever. You might be living in another country. However, there are some things that might help you as well, I hope. Of course, this is my own record and my own journey. So if there are ever days that I'm feeling a bit blah, I might look back over my videos and go, oh, there's one that I had a really, really good day. So I'm going to say goodbye now, because I'm going to do a bit of relaxing. I'm going to... Stoma bags, covers. Oh, really quickly. I bought a couple, and they're sealed at the bottom. They're kind of crappy. I don't sew, but I do crochet. So I might work out to see if I can make some kind of pattern to make a stoma bag cover. Just because if I'm wearing a clear one, it's nice to cover it up. I let it hang out at home, and my partner hasn't said anything, but I just don't want to be flashing a clear bag of poops at him. So, yeah, I'll see how I go. I don't know exactly how successful I will be, but I'll do my best and see if I can write down a pattern. I haven't got it in my head what I'm going to try and do, but whether that's going to work out in practicality or not. In theory, I think it's good, but we'll see how we go. So if so, I can always post up a pattern for any of you crocheters out there who are finding it hard to find stoma bags, covers that you like and that kind of suit you. And also they're about $15, cheapest ones. So, $3 ball of cotton. Might need one or two. See how we go. All right, my lovelies. I will check in with you soon. Thanks for listening. Bye.